Okay. All right, guys, let's jump into it. It's our weekly drop on Wednesdays. Today, I want to talk about who is checking the checker. All right. And let me tell you a story time first. All right. I had a missed call, woke up to it in the morning. The call was at midnight. Okay. My time, Eastern time. Midnight. All right. So I'm like, okay, maybe this person butt dialed me. Nope. She's a 3-hour time difference. And she had her survey. Not only did she have a survey, they were trying to give her an IJ for staffing because the nurse didn't show up. But secondly, she was getting other citations. So I want to ask, who is checking the checker? And this next citation came about from a pharmacy services. Okay, this is, unfortunately, she did get a citation for it. And what I want you to ask yourselves today, whenever you watch this video, who checks the checker? Okay, so let's just divvy on back first to the IJ. I know you're thinking, like, how do I just bypass the IJ? All right, for one, this isn't in the state of Pennsylvania. This was in another state. However, I will say the one thing I like about getting DONs that are in so many different states is that you will begin to start finding a trend of different citations that populate throughout other states. So the reason for the one citation that was not the IJ, what that was that they were trying to give her for the IJ was because the medications then were late for the nurse to administer those medications, meaning you had diabetics, residents that had high blood pressure, and so they were trying to give her an IJ for that. They did not give that, but of course they stayed until they situated everything, and then they had to put a plan in place for that. All right, so that is the one thing. Always have a backup plan for, if a nurse doesn't show up. What is your process? And if you don't have one, you can put in a quick one to say, hey, nurse is not to leave until the relief is there. If you have another RN in the building, whether it be a wound nurse, an infection control nurse, a unit manager, that person can jump on that cart so medications aren't delayed. All right. Another thing you can think about is your time that you administer your medications. You can look at the times. All right, that can be another adjustment so that your medications do not become late. But on a more serious note is when she said that she got cited for pharmacy services, and the reason why she got cited was for medication that they found during her survey in her refrigerator. So when you're doing this, I want you to start thinking about the 5 rights of delegation. Okay? Even though you appoint an outside service to provide services to your facility, I still want you to start thinking about the 5 rights of delegation. Okay? The task, the circumstance, the person, the task, circumstance, person, the direction and communication, and supervision. All right, supervision is actually the 4th task, okay? All right, so these are actually switches, supervision and then the direction. So say, for example, if you have an outside service that comes and provides services, all right, at any given time, explain what the expectations are going in, all right? Meaning, okay, I'm the pharmacy representative for this company. I'm coming in. They have their own to-do list anyway, but you can still set the expectations for them, okay? And then debrief with them before they leave the facility. Okay, before you leave the facility, and have them sign off on something to say, okay, yes, we checked medication rooms, we checked pantries, we checked, your refrigerators. We didn't see anything expired, or we did find some things that were expired, and these are the things that should be taken care of. All right, because now you're going to have that communication that's going back and forth between you and that person. And then you're also going to find out the root cause. All right, anytime an outside service come into your facility and they find something, you need to root cause that. Okay, how does something like this get missed? All right, now for this situation, the facility got cited for medications, suppositories specifically, that was dated from 2022. Okay, so now this is 2024. And this pharmacy representative, we're checking this every month. Okay, every month. And it's not to say that we don't make mistakes and we don't lose sight of things, but if you have the same person coming in and doing the same task every month, all right, you might want to take a look at switching up, having somebody else coming in, because I want you to start thinking about who is checking the checker. All right, and you can also, as the DON, go back through everything that pharmacy representative said that they did, and then go back and check to make sure that you are checking what they have provided for you, because now this is an unnecessary citation that she has. All right, and then also what I would do is I would bring this through my QAPI meeting, and then I will also speak to their higher up to say, hey, we're paying for a service, to have you have us survey ready all the time, and now we had medications that were expired, and your representative checked this all the time. But another person that's supposed to be checking are your unit managers, your night shift nurses. These appointed people also should be checking that. All right, so anytime someone comes into your facility, you exit with them. All right, and I don't care what service it is, whether it's hospice, whether it's dental, vision, hearing, podiatry, pharmacy services, your physicians that come into your facility. Anybody that comes into your facility, be sure that you're exiting with them, okay? Because this is going to provide you feedback. It's going to set clear communication, okay? Meet with them before and then meet with them after, utilizing the 5 rights of delegation, all right? Sometimes we're in these positions and we have so much responsibilities, we can lose sight of things. And this is why we have outside services to kind of help bridge that gap. But when the outside service is also missing things, then we still have an issue, all right? So it's not a blame game. It's just identifying the root cause, because there are other people who could have caught this also. But it's just, unfortunately, it led to a citation. All right, so I wanted to bring this up. As always, if you have questions, you can email me, consultant@welcometolongtermcare.com. Like, comment, and subscribe to my channel, and definitely sign up for my email list, because like I said, I send out emails 3 times a week talking about things that are going on in nursing. All right, so I hope this video helps, and have a great day.